Hey folks, Scott Raffa here. We're back again, another video topic to talk about. We're here to discuss ambulatory spine surgery, ASC surgery, outpatient spine surgery. What does this mean? What are all these terms here? We talk about them. We say, hey, we're going to be in an outpatient surgical center. Oh, this is an outpatient procedure. No, this is an inpatient procedure. We're going to go to the ASC today, and then we're going to go to the hospital later on. I mean, what does this mean? How do you take care of patients? How do I absorb all of those details and talk to patients and say, this is how we're going to care for you, and what does that mean? So the biggest ticket item is probably, what is an ambulatory surgical center? It's typically, from my understanding, a center that operates independently of a hospital system, not near a main operating room with an entire architecture and structure to it. It works on its own regard. There's patients that go to this facility, sometimes freestanding. They have an entire service both before, during, and after surgery. There's ORs there, there's procedure rooms there, and typically, and there's a full staff. There's anesthesiologists, doctors, nurses, the whole gamut. Recovery rooms. Typically, you're doing small types of surgeries there that are the same day. So you can do a surgery same day, an hour or two of surgery. In my hands, maybe an hour or two at most, depending on how much anesthesia you need, how long these things last. And then you got to recover the patient, get them home safely with their family for the next couple of days. So those are the types of scenarios that really facilitate and mend well with an ASC, an outpatient surgical center, or an ambulatory surgical center. Kind of the same difference. They're very synonymous, ASC or an outpatient center. So what does it mean to be at an inpatient facility? What does the difference mean at all? Well, if it's an inpatient operation, it typically means you're going to have to be hospitalized either for more than one night or even 2 days or more. So you're going to have your surgery, you're going to go to the hospital to have that done, or be admitted to the hospital thereafter in a neighboring area or structure on the property, and then you'll be there for a couple of nights, maybe 1 or 2 nights or more, to recover. Now, oftentimes there's not large cases going on all the time. A lot of small routine things we do last an hour or two tops. We watch patients overnight, and then they're good to go home by the morning or midday with their family. Sometimes you got to watch the patient for a couple of days because they really need a lot of help. It's a longer surgery. You want to be very diligent and see them every day, and they'll be there for 4 or 5 nights, but they still go home very successfully. So that's an inpatient scenario where they should plan a longer stay and recover. And then you can split the difference. What is outpatient surgery with observation? 23-hour observation, another topic. You're trying to say, how long can I watch this patient before things may turn over, and I have to watch them for more than a few days in the hospital itself. So the real question for me is, how do you make those decisions? How do you project what's the need? We always shoot for the least amount of hospitalizations, or even inpatient status, let alone hospitalizations or outpatient stuff. We want to see patients the same day, the next day, and really get them out first thing in the morning. That's typically within 24 hours. So most of our surgeries are going to be outpatient with observation, or they're going to be outpatient surgeries. 80% of them are probably in that scenario. When you have to admit them, you're going to see them every day, twice a day, and get them to be on the road to recovery, and it may take an extra day or two. So at the end of the day, that's really the biggest difference between outpatient surgery and inpatient surgery. What's most favorable to an ASC, going back to the original point, what is an ambulatory surgical center, and how well they take care of patients, what their capabilities are, which are expanding, by the way. A lot of things are more than ever going to ASCs, and the technology has favored that. The approaches have been updated. It's amazing. You can do so many things now in a fraction of the amount of time and get great results. So just be something to be aware of and cognizant as you hear more and more about the care plan. Thanks.